Hey, how's it going? Today I'm talking about the often forgotten parts about a healed injury.
This is Running to the Castle, a podcast for injury-prone RunDisney runners on a journey to running magical miles. Join me, Dr. Allie, as I share the secrets I've gathered as a runner, doctor of physical therapy, and coach. You'll learn the exact ways I get my clients to the castle strong without feeling broken or held together with KT tape as they cross the finish line.
Okay, I am watching a new TV show, Lioness, or new to me. Royal and I like to watch TV. We try and find TV shows that we like. We have found that we really like shows produced by Taylor Sheridan. So those are things like Yellowstone, 1923, 1883, Tulsa King, and now Lioness. It's a show with Zoe Saldana. It's really good. And in this episode, somebody gets in a car accident and mom asks, how long will it be for the bone to heal? And the doctor starts listing off all these things, including talking about muscles and the skin repairing and things like that. And when an injury or an accident happens, we often forget about all these other things. Mom, was asking about the bone. How long will it take for the bone to heal? Because she broke a bone. The girl broke a bone. Mom wants to know how long will it take for the bone to heal? And, to be honest, when we're thinking about healing, typically we're not thinking about all these other things. Well, I am, because it's ingrained in me to think about the sequelae, or the things that happen because of what needs to happen to heal the original injury. The sequelae is the big reason why physicians recommend physical therapy super early on in the healing process. Well, they do if they're good physicians, but it's also often why insurance denies physical therapy super early on, because they don't think about all that other stuff that happens. They think of right now. And in this TV show, the girl got in a car accident. She broke her distal femur. So that's the part of the thigh bone that's right above the knee. She needed an ORIF, open reduction internal fixation, to repair it. Basically, they opened up her leg, put the leg back in place, the bone back in place, and then put screws, rods, pins, things like that to hold it in place so that then the bone can heal around all that stuff. The bone healing will take 8 to 12 weeks to remodel. That we know. But what doesn't get considered in the injured person and their family is everything else that happens. The weakness, tightness, muscle loss, back pain, shoulder pain, neck pain. You might be saying, well, Dr. Allie, WTF? Why would somebody with a broken knee have shoulder and neck pain? And if it's from the car accident, wouldn't it heal when the girl's laying up in the hospital since she's not walking anytime soon? Well, yes, but I'm talking about the sequelae. I'm not talking about injuries, minor injuries that happen because of the car accident. So yes, maybe her shoulder and her neck will be painful from just like jostling around in the car and the accident itself. But I'm not talking about that neck or shoulder pain. I'm talking about the neck or shoulder pain that will happen down the line. Since she won't be able to walk for 8+ weeks, she'll be in a cast, non-weight bearing. She'll be using crutches or a wheelchair for some time. And someone who has to use crutches, has never used them before, or doesn't use them very often, will have a lot of body weight on their shoulders. But also, if she's doing a lot of moving around with these crutches, her shoulders, her triceps, if they're not strong enough, something's going to pick up the slack, and it's going to be the muscles in her neck to start working, stabilize things, help her move. So now she has neck pain. But also, she's not going to be sleeping in her normal position. Typically, teenage girls are curled up in a ball on their side or on their stomach. Now, she's going to be stuck sleeping on her back with her leg elevated, especially in the beginning, because her knee and her foot are going to be swollen. That's going to cause discomfort. But let's talk about the leg directly. When she's in a cast, it's going to be almost or all the way straight, depending on what they decide to do in surgery. And this is going to keep her hamstrings in a lengthened position, shortening the quads, shortening the Achilles, depending on the cast. Now her back and hips will hurt while she's in the cast. Her ankle and her knee will be locked at whatever position they leave her casted at for 8 weeks or more. And we have all of these things that are now adding up. I broke my elbow when I was 10. It was summer going into fourth grade. So I think I don't remember what age I turned in fourth grade. My birthday's in September, so whatever age that is, I turned at the beginning of the year. Anyway, broke my elbow in on June 10th. It's really weird. I don't know how I know that. June 10th I'm pretty sure it was June 10th. Anyway, I broke my elbow in the summer. I was doing gymnastics. I was on the tumble track and I didn't go straight. I landed on my back and my elbow, just the edge of my elbow, hit the edge of the siding. Now, it's normally covered in padding, but the padding was moved and I chipped my elbow bone. So I was in a cast, in a 90-degree cast, from my hand up halfway through my humerus, my upper arm there. And so when I got out of that cast, the bone was healed. But when I went to go and use my arm, it hurt. Now, I've used this story in the past to talk about how pain doesn't mean there's injury, because in this instance, there's no injury anymore. However, there is tightness of the muscles, tightness of the triceps, tightness of the skin, tightness of the joint capsules, because they had been stationary for 4 to 6 weeks. I forget how long it was. It was a super minor chip, so it was anywhere between 4 and 6 weeks in the cast. That's all I needed. But when I came out, I couldn't bend and straighten my elbow without it hurting. Now, I didn't need to go to physical therapy because I was an active 10-year-old. The doctor knew, my parents knew I was going to work it out myself, and that's fine. I don't recommend that anymore, knowing what I know now. We were lucky that I kept doing it. A lot of kids, a lot of people, adults, are going to stop when they feel the pain. They're not going to know how far to safely push through that discomfort. So my elbow was locked in place. All of these things are tight. My triceps is weak. My biceps are weak. I was weak, had atrophy of the muscles, and I had an elbow that was stuck in place. That all happened as sequelae. It was a necessary thing to happen because of the fact that I broke my elbow and needed to be in a cast. Now, as this relates to us runners, when we have some kind of accident or injury and we can't do what we normally do, or we have to have a brace on, have a cast on, we often forget about all of these other things. I read Facebook posts, people putting things up in different running groups, in my Facebook group, things like that. And I saw somebody talking about she had to be in a boot for a stress fracture and wondering what she should do to stay active. And so another physical therapist, and I tacked on to this and I agreed. One physical therapist said, go get an even up. An even up is something that you put on your shoe to even up your leg with the boot. Because if you've ever walked in a boot, it's very uneven because of how much padding and structure is in that boot. If you aren't wearing an even up and you need to be in this boot for 8 to 12 weeks because of a stress fracture or stress reaction, if you just walk around with this boot on, which you are allowed to walk on it redistributes the weight so that you don't need to worry about putting undue pressure on the healing tissue. However, if you don't have an even up, you are now going to have back pain, hip pain, possibly knee pain on the other side from walking funny. And because 8 weeks, in the grand scheme of things, it's a short amount of time. Like when we're talking life, 8 weeks, not that long. but it doesn't take that much time. It only takes a couple of days of walking funny to start irritating something else and throwing other things out of whack. So, to prevent the sequela of the hip pain, the knee pain, the back pain, get an even up in this case. This is also why I recommend any runner who has to be in a boot to go to physical therapy. The doctor might say, well, you can't do anything in physical therapy right now, so you shouldn't go. Many doctors will say that. The good ones will say, oh, yeah, I'll totally write that for you. Because what you can do is you can go and learn and practice other exercises to prevent the atrophy and the weakness at the other parts. Sure, you're going to be in the boot. You're not moving your ankle around. You're letting that heal. But you can learn hip exercises, core exercises, knee exercises so that on both sides, you don't lose muscle. Because if you're not doing all of the activity that you're used to doing, you're going to lose that muscle. So you can go and learn non-weight bearing exercises to do, or some weight bearing, because if you're in the boot, you can do some weight bearing exercises because that, like I said, the boot distributes the pressure evenly. You may also be allowed to do some safe motion at the ankle without putting weight on it. So then your ankle won't tighten up and you won't need to now deal with a tight Achilles or plantar fasciitis when you come out of the boot, because those things happen as well. Because you're in the boot for so long, your foot is locked in this position for however many hours a day you have to wear it. And then these other things get affected. And so then, yes, you're healed from the stress fracture, but you can't go right out and run again because you've lost muscle. You have lost mobility in different parts of your body, even if it could be in your hip, even if you aren't locked up at your hip, but you're not doing your normal everyday stretches and movements. 8 weeks, that's plenty of time for your hip to start tightening up. And so you can prevent all of these other things. It's not just about the one individual injury that's happened. It's now what's going to happen next because of this. And it's one reason why insurance stops paying when they do and they don't approve certain things, because they don't care about that. They care about the what is happening right now. I had a patient years ago. This was when I still worked in the physical therapy clinic, didn't have my own business yet. It was probably 2017. I had a 17-year-old soccer player, female soccer player. She tore her ACL. Her insurance only approved 20 visits per calendar year. Hard stop. There was no appeal process. That was it. Now, if you've ever torn your ACL, or if you are a fan of sports and know professional players tearing their ACL, you know how long of a rehab process that is. That is 9+ months, minimum 9 months. If you're Adrian Peterson with all that money and all of that prioritized strategy to get him rehabbed, you can get back to the NFL in 9 months. That was a very extreme case. Most people, it's 12 to 16 months getting back to their sport. And insurance also doesn't care about sports. They care about functional daily activity and pain. Typically, once the pain was gone, they stop paying. So that's why it was so important for me as a physical therapist to also have an activity-related diagnosis, so difficulty in walking, difficulty gait, abnormal gait, something like that, to have as the diagnosis, so that it wasn't just knee pain. Because once the pain is gone, if that's the reason they're in physical therapy, well, once that's gone, they're not paying anymore. So we need something else that we can track in progress. Anyway, 20 hard stop visits for this 17-year-old great soccer player planning to go Division I or Division II in college, was going to be out her whole senior season, because this happened at the end of her junior season, I believe, if I'm remembering correctly. So 12 months to 16 months later, well, now we're already into spring senior year. There was no getting around that. That was fine. But the 20 visits per calendar year, we needed to maximize. Now, luckily, she did get surgery and hurt it at the end of her season. So that was November sometime. But 20 visits with an ACL rehab, the first month is sometimes 3 times a week, and that's 12 already from November to December. But we maximized those visits and then we pushed them out the following year because we needed to make sure that we were tracking all of the sequelae and managing that stuff as it was coming up, trying to prevent it as we were able. But you just can't prevent all of it. But, the ACL, that got repaired in the surgery. And then I forget the timeline. I don't really deal with acute ACL injuries anymore, so I forget what the exact timeline is. But for conversation's sake, let's say it takes 12 weeks for that to remodel and heal once the surgery is done. Again, don't take me on that timeline. I'm just talking about this timeline for conversation's sake. That 3 months, well, we're already into the new calendar year. And we haven't even been able to get to a lot of things yet because of the way the ACL protocol is written by research, because they've researched it and you don't want to put undue stress on this healing tissue. But there's so many things that we can't do just because of a timeline's sake. And there's so many things that we need to prevent: hip pain, back pain, weight gain. On average, somebody who tears their ACL gains 20 pounds in the 6 to 12 months after their surgery or after the tear, because they just aren't active anymore, because they just can't do as much as they used to. So we want to be able to prevent those things, and figuring out how we can prevent those and thinking about it. That's what I do. It's ingrained in me. But let's take this back to what we were talking about in the beginning. All of these different things that we need to think about, the different sequelae. You're not going to be able to know all of these different things because it's not part of your everyday thought process. That's okay. That's where asking a professional comes into play, because it's not just about the one injury that's happening. It's not just about the broken knee in the TV show. It's not just about the stress fracture in this runner from the Facebook group. There are so many other things that come into play that you can do something about while that part is still healing. So if you have an injury and you get frustrated once that injury is quote unquote healed, that you have pain elsewhere, you're not able to run like you were before, it's because of all these other things that are happening. And let's not forget that other things turn up when we aren't able to move in the same way that we always have because of an injury, and things come up because of the fact that we need to do whatever it is to heal this injury. Take the healing with some grace, some patience, and research, or ask the professional, what other things do I need to be looking out for, and what can I do now to get back to my best self as soon as I can safely. Please take what you've learned in this episode and use it to adjust your strategy for your RunDisney race training. It's not about doing more. It's about doing the right things in the right balance so you can finish strong, not broken. And if you want personalized guidance specific to your race, your injury history, your running background, and your goals, that's exactly what we do inside Stronger, Faster, Finisher. You'll get step-by-step instructions and a proven system to help you train smarter from start to finish. Join the waitlist today to be the first to know when it opens next. That's all for now. Talk to you soon.